Hi, Dr. John Lamonaco here. I'm a surgeon in Houston, Texas, over at the Methodist Hospital down here in Clear Lake, and I wanted to talk to you today about immunotherapy and its effect on COVID-19 because I think it's something that not a lot of people know about or understand. I also think that it offers some very promising early results for treating this terrible disease. As a plastic surgeon, you might ask, what do you have to do with infection control and immunotherapy? More than you might think. Snake bites are often the realm of plastic surgery treatment, especially when they occur on the hand or on the foot. I used to see a lot of snake bites from up in the woodlands when they were still developing that area, kind of old. And we would use antivenom, which is an antibody preparation to bind the snake venom and take it out of the system. Also, breast cancer patients who plastic surgeons often see are treated with immunotherapy these days. Some of the newest and most exciting drugs will bind to the cancer cells. The antibodies bind to it, kill the cell, or allow it to be killed by our own immune system, and patients don't experience the same toxicity as regular chemotherapy. And there's been some very exciting and interesting results for breast cancer. So, as an attending burn surgeon at Herman Burn Unit, which I did for a couple of years when I was assistant professor in the medical school, we had patients obviously who didn't have any skin, their immune systems were at risk, and they were at risk for severe infections. So we had a very strict isolation and handling protocol to manage our infections in the burn unit at Herman, which is one of the best burn units in the world as far as I'm concerned. We've got a fair amount as a plastic surgeon of background in infection control. Flesh-eating bacteria is another thing. Plastic surgeons are often involved in the reconstruction and care of those patients. So, interestingly enough, infection control, infectious disease, and immunotherapy are things that the plastic surgeon often needs to be knowledgeable about. So let's talk about immunotherapy for COVID-19. Well, the most basic form of immunotherapy is your own immune system. Let's talk about how that works just for a second. For that, we need to make some guacamole. I made it earlier, actually. So here is an avocado pit, and I've stuck some needles in it. The avocado pit is this doggone virus, and these needles are what's called antigens. They live on the surface of the virus and identify it for what it is. Our bodies naturally develop a recognition of these antigens, and then they form antibodies. And these antibodies will then stick to these antigens. And by doing so, they disable the virus to where it can't work anymore. Or they signal the white blood cells, and I borrowed my daughter's ball for this, to stick to the virus or engulf it, and they'll destroy the virus, which is good news. And this is what naturally occurs in people who overcome the infection on their own. They become immune to it. Some patients, maybe because of advanced age, maybe because their immune systems are a little bit weaker, cannot form antibodies quickly enough before the virus is spread throughout their bodies and cause severe damage. So our own immune systems, of course, are the first line of defense. Secondarily, because our body has never seen this doggone COVID-19 virus, we're naive to it. We don't have pre-existing antibodies. So another way to protect yourself, aside from getting the infection and recovering, is to be vaccinated. And a vaccination simply injects into the skin or your muscles or your blood these little antigens, these little colored pieces here, pieces of the virus, hopefully not the whole virus, and that will cause your immune system to build up so that when you do encounter the live virus, your antibodies can then stick to it and destroy it. The problem with vaccines is we're at least a year away from those. They require extensive testing to make sure that they work, because there'd be nothing worse than a vaccine that you think protects you and doesn't, right? So we're a long way away from that. But what can we do to shortcut that process? Well, the first treatment to do that was done here nationally at Methodist downtown in a very critically ill patient. Another study, which I'm going to refer to right now, was done in China on about a dozen critically ill patients who received this therapy. Patients who had recovered from the disease donated their blood, and their antibodies were then separated out from their blood, and those were injected directly into the bloodstreams of these very ill patients to try to stop the viral progression. Well, the results were very interesting and positive. Number one, the fever decreased. In some patients as early as day 1, others it took all the way to day 14, but there was a noticeable decrease in the fever of these patients. Number 2, their multiple organ failure, which happens with critical illness and can happen with this virus very commonly in susceptible patients, got better. There's a number to look at the organ failure index, and that number got better in patients who received these antibodies from healed patients. The other thing that got better was their viral counts. The amount of virus circulating in their blood and on their tests went down when they received the immunotherapy. It's too early to know whether or not that small group of patients are going to represent everybody, and there was no control in the study. If you're going to do a proper study, you can't have all young, healthy people in one group and treat them, and then have older, unhealthy people in another group and try to compare the two. You've got to compare apples to apples. So the next step is going to be to match patients, to find this patient who's the same age and health conditions as that patient, give one of them the immunotherapy and the other one standard drugs, and see which group does better. That's going to be something that just takes time. I've been following that research very carefully. If I find anything else about it, I'll post an update. But again, thank you for watching. Try not to be too detailed here. If you have any questions or comments below, please leave them, and feel free to ask me anything. We're all in this together. And right now, it's kind of the quiet before the storm at the hospital that I'm at. So in the meanwhile, I thought I could post up some good information. Have a good day, and you all stay safe. Wash your hands. Yeah, every day, all the time. Thanks.